Dear students, we are in the second part of the topic infantile hemiplegia. Continuing, so the differential diagnosis in the child which may mimic similar to that of the acute hemiplegia are mass lesions such as any neoplasms in the brain, trauma, HSV encephalitis, that is herpes simplex virus encephalitis. Earlier we did talk about acute disseminated encephalomyelitis also. So this will also is another kind of infection where herpes simplex virus infection leading to brain and that is encephalopathy. Post reversible encephalopathy syndromes, complicated migraine, and other metabolic diseases. So these conditions can show acute hemiplegic like symptoms. So this we have to be aware. So what is a stroke definition? First we'll go to the stroke definition. Sudden occlusion or rupture of the cerebral arteries or veins resulting in focal cerebral damage and clinical neurological deficits. Sudden occlusion or rupture of the cerebral arteries or veins resulting in focal cerebral damage and clinical neurological deficits. A clinical definition of stroke is a focal neurological deficit lasting more than 24 hours with neuroimaging evidence of abnormality in an established vascular territory. WHO's definition of stroke: a clinical syndrome typified by rapidly developing signs of focal or global disturbance of cerebral functions lasting more than 24 hours or leading to death with no apparent causes other than that of vascular origin. If any cause other than vascular, you cannot call it as a stroke. So classifying that: hemorrhagic per ischemic, venous or arterial, cardioembolic or thrombotic. Arterial ischemic stroke in perinatal cause may be either perinatal, that is congenital perinatal neonatal stroke, that is 28 weeks of gestation plus or minus 1 month, that is usually neonatal is 28 days after delivery. So this is called as perinatal, congenital or neonatal stroke. Childhood, this one, stroke, acute stroke, that is 1 month, that is 1 month to 18 years. One below 1 month is neonatal. So arterial ischemic stroke of age group between 1 month to 18 years is called as childhood arterial ischemic stroke. Epidemiology: childhood stroke. This is these all these studies are basically Western countries, basically USA based. Childhood stroke normally seen in 2.3 to 13 children per 1 lakh live birth population. So among 1 lakh children in given birth in USA, almost 13 children are having childhood stroke. Neonatal stroke is comparatively more, much more. Among 4,000 live birth, there is one neonatal stroke. Boys are more than girls, according to this study in Lancet Neurology in 2008. Blacks more, then Asian, then whites. So blacks are more prone for stroke, then Asian, and then only the whites, including the mortality, both in the stroke, what you call prevalence of stroke as well as in the mortality. Ischemic causes are more than the hemorrhagic causes. Then American Heart Association also says that 55% of is ischemic. So hemorrhagic may be the rest, that is 45. Clinical presentation: infants may present with focal weakness. So focal muscular weakness will be seen. More likely than older children present with seizures. So older children may having seizures also along with the focal weakness and altered level of consciousness. Clinical presentation in older children. In older children, there will be hemiparesis, that is not what you call as semi weakness or partial weakness. Hemiparesis, not the total weakness. We call it as hemiplegia. Most commonly, the cause among the ACA, anterior cerebral artery, middle cerebral artery, posterior cerebral arteries, The middle cerebral artery is most commonly seen territory. Other focal neurological deficits may be seen. Aphasia or dysphasia. This is related to difficulty in speech. So what are the risk factors? So risk factors which may lead to vascular insults are vasculopathies. Any vasculopathies, examples Moyamoya disease, most commonly seen in children, and post-varicella zoster, TCAC, vasculitis, inflammation of the vessels and leading to that inflammation may be due to some kind of infection and inflammation such as meningitis, systemic lupus erythematosus and Takayasu, which is like a thickening of the arteries happening in the in the child, like adult, even 10 to 11-year children, boys or girls, mostly seen in boys. Embolic conditions such as congenital heart disease, complex CH congenital heart disease, acquired heart disease, that example rheumatoid heart disease, infective endocarditis, intravascular, that is hematological sickle cell anemia disease, prothrombic states such as the related to platelet coagulative diseases, congenital in the this is protein SC deficiency. Then the acquired in this case are hematological are L. asparaginase anticardiolipin. So these are the other etiological factors, which are risk factors, which are leading to other etiology, that is mainly vascular. So all these risk factors may lead to vascular accidents. Examples of childhood arterial ischemic stroke risk factors are cardiac. So already this is again we are going through the same, but with the addition of genetic: cardiac, congenital heart disease, valvular heart disease, cardiomyopathies, cerebral arteriopathy, focal cerebral arteriopathy, Moyamoya disease syndrome, such as, and any kind of dissections. Infections, varicella, meningitis, hematological sickle cell anemia, thrombophilias, iron deficiency anemia. In case of genetics, neurofibromatosis type 1, homocystinuria. So what are the panel of investigations usually has to be done when somebody has infantile hemiplegia? Neuroimaging, that is, it can be either computerized tomography, that is CT scan, but versus the MRI and the MRI of the MRI scan of the head and neck. Infection screening, basically, which is mainly from the CSF, doing a lumbar puncture, take out the CSF and do a proper infection screening. Echocardiography to understand the health of the heart. Connective tissue screening has to be done to see that any risk factor diseases leading to the vascular problem, vascular conditions, vascular disease. Doppler studies may be also be done in this case also. Thrombophilus screening for any kind of thrombotic like disease. HIV testing, basically to know the immunity of the level of the child, or to see that congenitally the child has conceived hepatitis virus from the parents, or metabolic disease such as homocystinuria. So all these investigations has to be done because we are talking about a small child. It is not the child, usually in children it is not related to atherosclerosis or high cholesterol, high BP in adult. So we have to look for other conditions, and without, if you don't look for that, then the child is in danger. Treatment or neuroprotective treatment. So neuroprotective, protecting the neurons from further damage. So basically the neuroprotective, that vitamin B complex and other neuroprotective health related, neuro health related medication, antithrombotic to prevent any kind of further clotting, you know, and thrombolysis. Experimental thrombolysis can be given in acute stage, not for a continuous treatment. Important part in the rehabilitation is physiotherapy, and nowadays we have a lot of other treatment to improve revascularization. If you bring the child to the neuro ICU within 1 hour or so. Acute management includes oxygenation. Important thing, oxygenation, perfusion or cerebral perfusion. Glycemic control, important thing to maintain the glucose level, maintain the temperature, and if at all there is any anemia, especially in related to sickle cell anemia, if it is already diagnosed condition, and if there is a normal anemia also, we have to do whatever is necessary to maintain the hemoglobin level. Thank you.